Welcome to episode 5 of Speaking of Women's Health, a podcast that's designed to talk about women's health programme that we ran in Dorset last year with NHS Dorset, looking at a whole bunch of stuff around women's health. And today we're talking very specifically about mental health. And my lovely co-host Anjali is here as always. How are you, Anjali?
I am really good. How are you? How's your mental health today?
My mental health today is good, and I have to say this subject is a real passion project for me. Partly because my mental health has not always been really good. I have struggled with my mental health all my life, right now, and great, but it hasn't always been. And because in a previous job, I was working in a mental health charity, so you kind of get to know the ins and outs of what's going on in terms of support for people. And I don't think we talk about women and mental health enough.
Absolutely not. So I can say that we have two guests indeed, but we have you also today who has worked. So we are getting a lot of important information because this topic is also very, very, I'm going to say close to my heart, but very important for the awareness point of view, especially in minority and ethnic background. I hope we'll get a lot of important information, and I have a lot of questions to ask.
Well, it'll be a very interesting conversation, partly because I would love it if there was just more out there for women and mental health, and that the mental health services were far more in tune with the kind of mental health problems that women have because of their hormones, right? Periods, pregnancy, during pregnancy, after pregnancy, and during menopause. They said in unison.
Menopause.
You know what I'm talking about.
Absolutely.
And, these things kind of tend to get a little bit brushed under the carpet by women themselves, of course, but also it's just a personal opinion, right? That
absolutely.
I'm not sure that I would say there's enough support for women, specifically for women out there. There are some amazing things, don't get me wrong, but never enough. So we've got two brilliant experts on today. We've got, Jagoda Banovic, who is the head of Perinatal Services. So services for women who have a mental health condition and then are having a baby. So quite often, if you have a mental health condition like bipolar or schizophrenia, this gets worse. So Jagoda runs services from Dorset Healthcare Trust, supporting women in their mental health during that time. And we've got Dr. Joanna Yilmaz, who is a clinical psychologist, and she works with mums who have had a particularly traumatic birth, so dealing with their mental health after a difficult delivery. So what a couple of powerhouse women we've got on today. I can't wait to hear what they've got to say. And I'm sure you will have your usual, angle on, women from marginalised communities. And, mental health is a stigma in any culture, Anjali, but I've heard you say before, and you and I have talked about it. Is it a stigma, a taboo?
Absolutely. I mean, I would highlight this, and I have no shame to say that Asian countries and my culture, if we talk about mental health, still there are people who just see you like you are mad. Oh, there's nothing mental health. It's just like you have excuse. You're just talking excuses, giving excuse not to do things. So yes, that mindset is there. And I really hope this episode will change one person. So I'm happy with that.
Well, I hope we change more than one, but that's me.
I know.
I'm always usually overly ambitious. And I do think these two are such experts. And it's such an interesting conversation that let's see if we can change the views of more than one. So today's episode is about women's mental health specifically, so the kinds of mental health conditions that women experience that men don't, like those that happen around periods, menopause and pregnancy. And I have got with me today two incredibly skilled and experienced people, and I'm just going to ask you to introduce yourself so that everybody knows who is here, because you've got such interesting jobs, you two. So Jagoda, why don't we start with you? Just introduce yourself, just say who you are, what you do, what your day job kind of looks like.
Hi, really happy to be here, Mariana. Thank you for inviting me to have a conversation with you and Joe. My name's Jagoda Banovic. I'm the head of Perinatal Mental Health Services for Dorset, and I'm an occupational therapist by background, which I'm very proud of. So what does my day job look like? incredibly busy, which is good and exciting. But generally, I suppose to try and give people a bit of an insight, my role is probably to have that overview and oversight of the mother and baby unit, the perinatal community mental health team, and the maternal mental health service, which Joe's the consultant lead for. So yeah, it's just to sort of keep it ticking over, really, doing a bit of horizon scanning, making sure that we're linking in with national policy. So obviously the 10-year plan is a big thing that we're looking at now. And just supporting the team to deliver a service that I'm really proud of.
It sounds absolutely fascinating. I can't wait to kind of get into the detail of that with you about all those incredible things that you're doing, such important work that you're doing. But first, Joe, introduce yourself, tell us who you are and what your day job looks like.
Hello, so my name is Dr. Joanna Yilmaz. I'm a consultant clinical psychologist. I've worked for my entire career in adult mental health generally, in community mental health teams and NHS talking therapies. But I've always had a strong interest in perinatal mental health. And for the last 2.5 years, I've been leading the Dorset Maternal Mental Health Service. So I work very closely with Jagoda and with the perinatal team. But the Maternal Mental Health Service is a specialist psychology service for women and birthing people in Dorset who have experienced maternity-related trauma and or loss. So I work with women who've experienced traumatic births, sometimes sadly where their baby has died. We work with women who've had recurrent miscarriages, fertility difficulties, stillbirths. And the aim of our service really is to provide specialist talking therapies, psychological therapies, but to fill some of the gaps that were there in existing services. So before maternal mental health services were launched, it was recognised that there were certain groups of women who weren't getting a service with the current service structure. So that's why services like ours have been set up across the country. I work with women, so I work directly offering one-to-one therapy. Predominantly, I'd say that the biggest presenting issue we see is traumatic births. And I also work with the maternity services. So we work with midwives. We provide training, supervision and support to midwives and their colleagues working in maternity. And we work very closely with other mental health services as well across Dorset.
Well, I mean, again, very important work that you do. Just to explain the expression you've both used, perinatal mental health, that means what?
For the purposes of our services, it's the period that covers from when a woman becomes pregnant, and in our sort of circumstances, we're going up to caring for that woman and her family up until the infant's 2 years of age. We also do preconceptual work and advice as well, but it's that period really from sort of the birth of the baby up to 2, but in terms of the mother, it's the antenatal care from when she's pregnant.
Okay, so perinatal means anything to do with pregnancy and birthing for the mother.
Yeah.
And so your side of things, Jagoda, you kind of deal with those mental health and quite serious mental health challenges that some women experience around that time. And Joe, your work is around after birth, generally speaking, supporting mums that have had a difficult time. Just to sort of understand the difference of your two.
Yes, I suppose the key differences are, yes, most of our work is postnatal, so sort of after birth. We do work with women who are pregnant who may be very afraid or fearful of giving birth, perhaps because they've had a previous difficult experience. So we do some work antenatally. The maternal mental health service is not limited to that perinatal time period because it was recognised that some women don't feel able to come forward for talking therapy until their child is a little bit older, until they've perhaps kind of got a bit more headspace or a bit more time to think about themselves. And the perinatal team will also do a lot of work with the mother-infant relationship. So I guess that's another key difference. I don't know if you want to say more about that, Jagoda, but it's something the team really, really work with, isn't it?
I think the important thing to add to what you've said, Joe, really, because it's something that I'm reminded of when I work sort of nationally with other sort of heads of service and regionally, is that in Dorset, we decided with support of commissioners who help us to fund and develop services, we decided not to set a time limit on how long after a trauma a woman could come and get support and help, because I think at the time we just felt that it was important to appreciate that, as Jo said, that sometimes it's difficult for women to come forward and get the help and support that they need. And so I think that that's a really important difference, but also sort of demonstrates that close working between ourselves and people who commission and fund the services, and them supporting us in clinically sort of making that decision rather than it coming from a kind of a perspective of funding or policy or frameworks. Because what we wanted to very much do, a bit like you have done, Marianne, with the work that you've done, is to really think about women in Dorset and what their needs were. And we're a pan Dorset service, so we're not just working with women in a certain age group or in a certain area, and that has had its challenges because you don't know the number of women potentially that are going to need that service. But I think Jo and her team have just been incredible these past sort of 2.5 years at working really hard to try and meet that demand.
Well, I mean, that's a brilliant segue into my next question, really. I mean, this podcast is about a women's health program that we've been doing together for the last nearly 2 years now, which seems incredible that it's that long ago that we started. But I was determined from the outset that we had women's mental health on the agenda because with my own personal lived experience, but it's just generally speaking, it's not a subject that gets talked about very much. And I wondered whether you got a sense of some frustration around that in the work that you do, but also do you share the view that this really perhaps could be further up the agenda for women?
Yeah.
And if so, why? What are the sort of challenges that you experience in delivering these services for women that you would want a program like this to address?
Well, I think we've sort of talked before, haven't we? And I've said that it's interesting how women's mental health, we can't say that it's ignored, but you've been talking about the different sort of areas and that you kind of looked at in the different work streams, and that women's mental health was kind of in there in the background, but not at the forefront. And I guess that is very typical in our experience. And we have to accept that there is a limited amount of money to fund services. But I suppose what Jo and I and everyone that works in the perinatal service in Dorset is that we want to kind of highlight the challenges for women. And we think it's really important that women's mental health is spoken about, that services are developed and delivered around them and their needs. And I think that it's important that we continue to try and make sure that those voices of those women are heard and listened to, because one of the things that we know through research and from recent sort of Embrace publication is that younger women who have care proceedings involved in their pregnancy are at higher risk of suicide, and that's a really concerning statistic. And that's not the only reason, but I think for perinatal it's something that we are really minded of, concerned about. But then that sort of wider concern around those young women generally about, I suppose, that push and pull in society at the moment on them, and why it's really important that we do highlight it, shout about it, talk about it, and encourage women to come and forward and get treatment and help. And I think Jo touched on that, didn't she? Where she was saying that some women come to get support from the maternal mental health service quite some time after they've experienced that trauma. So yeah, I think it is a really important issue.
I mean, you could argue, and the way I see it is, and I'm sure I'm not alone in this, by the way, when a baby is born, that's the start of a life, and surely the mental health of its parent is the single most important thing that child then thrives and goes on to contribute to society, becomes a healthy adult. And yet the health kind of funding generally, I'm talking kind of nationally here, this isn't necessarily a Dorset problem, but we don't necessarily see our system like that, do we, in terms of really prioritising the well-being of parents in order that children then have healthy lives. I don't know. Am I barking up the wrong tree here, Jo?
No, I think over the last few years there has been more money. There has been, certainly funding for perinatal services was increased. It has increased. And I think there has been a greater recognition, really, of exactly what you were saying, that if you want to look after children and promote kind of children, the best outcomes for children, that looking after the mental health of their parents, both parents, but particularly perhaps their mother, is really, really important. I think there's still more to do. I think, as we've said, mental health generally is not spoken about enough. It's not got the same, the amount of investment and money and research as compared to physical health. So there's still a lot more to do. But I think there is greater recognition than there was, certainly. Things have improved, and many services do prioritise parents for treatment, for appointments during the perinatal period, for example, so that they don't spend a long time waiting when they could be receiving the treatment and support they need whilst their baby is still young. So there have been some changes, but there is always more to do.
And I think that one of the other key initiatives, which is a massive piece of work, really sort of changing the way that the local authorities and children's social care work, is the Families First Partnership programme, which I think was a Department for Education. I suppose it's looking back to the Sure Start programmes that we had previously, and just trying to create a kind of a new program to support families and young, and babies and children, and that early sort of start in life is really important, as we know. And I think that it's really great that Dorset County had adopted the program really early, and a brilliant colleague of ours, Jill Warren's been sort of working across health and with them to really move that forward. And this year it was really exciting to hear that, because of funding from Department of Health and certainly Wes Streeting and his team and his department are really keen on this to be rolled out, because I think before there was a bit of you could opt in and out of it, but BCP have now also commenced that program. So that's really exciting to just be able to look at, and you'll know, Marianne, the family hubs and some of the work that's happening around there. So, starting to try and join some of these services up and working together is really exciting. And, there's work sort of looking at the unborn child and what do we need to be doing as a system to support that. Health visiting are key in that program as well. So, and midwife. So there is work, as Jo said, and there has been funding. The challenge is always to target it in the right places to get the biggest impact. And, a massive system like Dorset, with all the different stakeholders in that, it's quite a piece of work.
And when you talk about perinatal mental health, Jagoda, you're not just talking about women who are a bit depressed, are you? You're talking about some really very serious mental health conditions. This is a big deal.
Yeah.
So could you just talk a little bit about the kinds of things that some women experience during this time? And also you mentioned care proceedings. So at some point, if you could just explain what that means. But I just think it's really important that people understand that this is serious stuff.
Yeah. And I think that it's really important to keep reinforcing that, because I think that over the last sort of 10 years, and this is a bit of a pet sort of thing of mine, as Joel know, there's been a real muddying of the sort of general mental health and well-being and severe mental illness. And my anxiety, I've been working in perinatal mental health for nearly 15 years now. And I think that my anxiety in the last few years has been that, do the resources start to get switched towards the bigger group of people, which is, people that have mental health challenges, mental health difficulties, away from that severe mental illness, which is kind of what perinatal services were really, that's why they kind of were developed. And so the sorts of conditions that we're talking about are things like bipolar disorder, psychosis, severe depression, and severe anxiety and OCD. And then with the maternal mental health service, I think I'm going to let Jo kind of touch on that, because I think she's much better at helping us kind of get an understanding. So they're the sorts of illnesses and conditions that we're talking about. And I think that obviously in the perinatal period, and obviously there's a hormonal component to that, but there's lots of other challenges obviously that happen. There is that risk of women becoming more unwell, of their mental health being sort of destabilised for different reasons. One of them used to be that medics used to advise women to stop medication if they were on it, which, in some cases that is the correct advice. But actually the medications that we use, and it might be really interesting to have one of our consultant psychiatrists on to discuss this in the future, are safe to use in pregnancy and in breastfeeding, and that's another area of expertise that perinatals develop. But these conditions really impact on a woman's ability to function. The day activities of daily living, of functioning daily, are hugely impacted if those conditions are not treated. And there's always that risk benefits around sort of medication, but we have lots of other therapies now that we can use to support those women. So, and I'm really sorry if I've forgotten or missed something off there. I suppose the other thing that we're really kind of starting to try and get a bit more of a better understanding of is neurodiverse women as well, and families, and just how that impacts on a woman's role as a mother and her ability to adapt day to day caring for a baby with some of those challenges. So that's what we're mainly talking about, and obviously is women who've experienced trauma in their past. So that's our business, I guess. But I'm going to hand over to Jo to hopefully Jo be much better at giving us an insight into what that might look like.
No pressure then, Jo.
Well, just before I talk about the maternal mental health specifically, just following on from what Jagoda was saying, I think what makes the area of perinatal mental health so interesting, but also so complex at times, is that interplay between the kind of biological factors, the kind of the hormonal changes, what happens to a woman's body during pregnancy, and actually how physically unwell people can be during pregnancy, with hyperemesis, lots of vomiting, with chronic pelvic pain, for example, all of those kind of physical factors that are going on. But also the huge kind of emotional and personal change of having a baby, or having a second or third baby, or having a baby when your previous baby has died, or going through the pregnancy and childbirth if you've had a history of trauma, of perhaps sexual trauma or medical trauma. And then kind of, as Jagoda was saying, perhaps there may be, the neurodiversity or other specific needs or individual needs that come into play with all of the other things that I've mentioned. So it can be quite complex, and all of that coming together at such a kind of pivotal moment in somebody's life, having a baby. And then the expectation that that's going to be such a wonderful thing. And of course it is, but it's also can be a very emotional event, a very upsetting event, distressing event for some people, or just a whole mixture of feelings, kind of some positive, some quite hard to sit with. So I think that's kind of just one of the things that attracts me to this work, really, but also why kind of specialist teams like the perinatal team are so important, because they can bring together a range of professionals from different backgrounds with different expertise, who can then support a woman and partner as well sometimes.
And I think the other thing that I just wanted to highlight is, and I think, having had the experience of being the ward manager for the mother and baby unit many years ago when I first started working and developing the services, is one of the things that I have found really inspiring is just when women are really struggling, really unwell, feeling like they're never going to bond with their baby, that they can't look after their baby. What I have seen on the unit and in the community, but when you're on the mother and baby unit, you get a real kind of up close sort of experience of women who absolutely do everything that they can to parent their baby well, and the support that they are willing to have from the brilliant team that we've got at Florence House, which is Dorset's mother and baby unit, and trust the team. And the team are incredible to always hold the hope for that woman and that baby and that family. And I think that for me has been something that has just continued to inspire me, and to really want to work as hard as I can and do all that I can to support women and families, because it's such a privilege to be part of that journey of becoming a parent it's something that really moves me. Every time I go down onto the ward, it really does. And we've just had a really lovely letter from one of the women that was on the unit with her baby. And, women saying things like, I wouldn't be here if it wasn't for you. You've really helped me to bond with my baby. And I think that is so powerful. And I think that the narrative so often now is that the NHS is broken, and yes, there's lots of challenges, but there's some absolutely incredible pieces of work happening in Dorset. And I just felt I really needed to say that, Marianne. So sorry if I've cut across and taken you off on a tangent. I didn't mean to.
It's not a tangent at all, because actually this is the whole point of this podcast, is that I just think it's really important that people out there understand that people like you two are working tirelessly every day to improve the NHS, specifically for women we're talking about, but obviously there are lots more other people doing lots of other amazing things. And we don't get the chance to talk about that enough. And we're always talking about the doom and gloom and the lack of money and the waiting times and the terrible experiences people have. And I thought it was about time that we talked about you and what you do. So that really would have been my next question anyway, in terms of what the kind of challenges are that you get up every day and go to work to try and tackle, and what do you actually do? How do people like you, Yaga, you referred to some work that Joe have been doing, really keen to hear about what that is, what that looks like. How do you go about improving something for women when there are, like you said earlier, Jagoda, there are a limited amount of resources, and yet you do it anyway. So what are the challenges and how do you go about fixing them? Joe, do you want to start?
Oh, that's a big question. When you talk about challenges, are you thinking for us as a service or just generally within the system?
So Jagoda referred to some really good work you were doing. So why did you do it? What was the problem you were trying to solve?
I mean, the thing is there is a lot to talk about.
And I think that is a challenge in itself, is that one of the things that as lots of people who work, probably anyone who works in the NHS and probably other systems too would know, there's always so many things that you want to do. And there's always so many things, you have a list of, your to-do list just gets longer and longer of things that you think, well, we could do something about this, or we could do something about that, or we could improve this. And there's never enough time in the week or resources to actually tackle all of those things at once. Part of our service, the maternal mental health service, is that we work really closely with maternity. And I suppose a really good news story that you may have seen in the news is about the maternity unit at Dorset County Hospital and their recent CQC rating and how well they've done and how well regarded their service is. And so working really closely with maternity and the kind of key role that they play in supporting women through this kind of the pregnancy and birth experience. And that's been a real feature of our work and something that's really, really important. We're involved, Jagoda referred to some work with social care, and we're involved in a big piece of work at the moment looking at the pathway for families who have involvement with social care in whatever way that looks. But our sort of specific part of that bigger piece of work is developing support for women who've had babies removed from their care. So for women who are at risk of separation from their baby, sometimes when they're pregnant, concerns are raised about whether they're going to be able to care for that baby appropriately after birth. And they may be separated from their baby either temporarily or permanently, and that can happen quite quickly after birth in some cases. And at the moment, or up until recently, there's been a real lack of support for women. Sometimes babies are removed from the hospital at birth, or they may be placed in sort of foster care or removed temporarily, and then the woman will have to go to court to find out the outcome, whether the baby is going to be returned to their care or not. And all the support has tended to follow the baby. So the baby will have a social worker, the baby will have a health visitor, they will have foster carers, they will have adoptive parents or kind of whatever else happens for them in the future. And absolutely rightly, the focus needs to be on the baby's safety and care and making sure that they are given the best chances and safeguarding their needs. But then the woman has been overlooked and forgotten. And I say woman, birthing person. There may be another parent around too, but very often it's a woman on her own. and there has not been the support available to them. So we're working on a really exciting pilot project with the maternity services at Dorset County, but also at Bournemouth, at Royal Bournemouth Hospital, to pilot the Hope Boxes. And the Hope Boxes were an initiative developed by women with lived experience, working with a team at Lancaster University. And Hope stands for Hold On Pain Easers. And it's like a memory box, but it's more than a memory box, really. It's a chance for a woman to work with a trusted professional, such as their midwife, to start to use the Hope Box to create a memory box for them and for their baby, but also it's a way of them processing the trauma of losing their baby and the grief that they feel, hopefully engaging them with other support services to address some of the needs that they may have in that, and to hopefully reduce what we are aware of is a repetitive cycle where women will get pregnant, and unless their difficulties and issues have been addressed with them, that they may stand a high chance of having another child removed from their care, which is further trauma for them, and another child ending up in the care system. So this is a kind of really exciting pilot project that we're still in the planning stages. It's one of those projects that it grows and grows. There's a lot to do. There's lots of elements to it. But what we want to do is to make sure that women who are at risk of separation or who are separated from their baby through social care proceedings have access to better, compassionate support, which they haven't had up until now.
I mean, it sounds horribly traumatic, Jo. I mean, what could you just help us understand the kind of reasons that a baby might be removed from?
Yeah, I mean, there's all sorts of reasons. It might be because there's either domestic abuse, domestic violence, or alcohol and drug misuse. It would perhaps be concerns over the baby's safety, whether they may be at risk of neglect. Sometimes there may be other people in the mother's life who may pose a risk to the baby, and I guess we need to be assured that the baby can be protected. Sometimes mental health, although I must stress that having a mental health condition is not in itself a risk to the baby, and because there is still that stigma out there that if you come forward and seek help for your mental health, somebody might come and judge your parenting and take your baby away. So sometimes there are mental health issues combined with other factors such as domestic abuse. Often these women have histories of quite complex trauma themselves. They perhaps are care experienced themselves. They may have brought up in the care system their kind of models of parenting, the parenting that they've experienced themselves, to kind of give them a role model has often been very inadequate or damaging. So there's a whole host of factors, and obviously one person's story will be different to somebody else's. But yeah, I think we're kind of really, well, I guess what we want to change is that there will be support available for the woman and for her needs, not just looking at the baby's needs.
And like you say, the ripple effect of that, if you take care of the mother into wider community and into the future and the costs of the NHS, it's not just that moment in time, is it?
It's huge, Marianne, you're right. And I think that one of the things that's really important to highlight and to stress is that this is quite a significant point in terms of the policy direction through the long-term plan, was to reframe that removal as a loss and to actually care for that mother and that baby and that family in a much more compassionate way. And at a time when sometimes it feels like there's not a lot of compassion in the world, I think it's really important to highlight that, because it is a bit of a change in the sense of direction that we're going in. And I think the other thing is that many other areas around the country just decided not to pursue and set up and develop that bit of the pathway that was part of those ambitions. I'm sure that, in time that will change. But, despite limited resources, I think it's, real credit to Jo and her service that, we really want to do this, and it being picked up by the organisations and supported across sort of Dorset is just really reassuring how much everybody wants this to change for women and for their children. Because as you said, Marianne, you're quite right, this just doesn't stop at that point. It goes on, that trauma and that pain, it goes on lifelong in most cases. And I think the other thing that I just wanted to add to that is, because of this work, And because of the model that we're trying to kind of adopt in Dorset, where we're looking at it from all different angles, I mean, to the point that we're talking to the courts and barristers as well about this, because that is somewhere where perhaps there could be some change as well. We've been invited to be part of the national group that's looking at a framework for this nationally, because it's acknowledged that it needs systemic structural societal change. And that's really exciting to be able to share what Joe and other people that are part of that steering group, what we've achieved so far in Dorset, to be able to take that and share that with the national team.
I mean, I think that's such a really good example of where, Dorset's not perfect, but for some reason within the system in Dorset, this really good thing has happened. So you've mentioned it, but I'm sure, Joe, you could have woken up in the morning one day and thought, right, I want to go and change this, but you could never have done it alone. So what is it within that Dorset, who else out there is also gunning for women, wanting this to be better and wanting things to improve for them? You mentioned courts and barristers, Jagoda, but who else gets involved in this stuff?
Well, the project I just mentioned, I think we really have to credit the safeguarding midwives, both at UHD, University Hospitals Dorset, but also at Dorset County Hospital. So Kerry Medina, I'd like to give a shout out to her, because this was something that she really wanted to introduce, the hope boxes particularly, and that's something that has been really taken forward within our kind of local maternity and neonatal network. And so her counterpart at Dorset County Hospital, Katrina Cunningham. So they've been really instrumental in this. But I think it is something that, social services, social care colleagues, health visiting, adult mental health colleagues, for those who work in community mental health teams, because they're often working with women and the families further down the line as adults. And so, it's been something that actually everyone that we've spoken to about it has been really, really interested, really keen in wanting to see change in this area. So I think it's something that people, different people, the academic mentioned the courts and barristers, they've been aware of this for a long time and perhaps not been in a position to do much about it. And so they're really keen to see change too. So yeah, it's a really good example of how when you can get people working together across different systems.
I mean, I've got a sense, actually, recording a number of these podcasts, that there does seem, for some reason, to be a really good appetite in Dorset for people to want to work together to improve things for women. I really get a sense of that. Do you feel that as well?
Yeah, definitely.
Yeah.
I think, you have to kind of give credit to some of the women in healthcare in Dorset who are sort of doing this stuff and pioneering before the government, decided to invest in perinatal mental health. Our colleague Jo Hartley, who's director of midwifery at Dorchester County Hospital, I mean, she had a specialist mental health midwife that wasn't funded through long-term plan money. She just, that money, she managed to get that. I think that's the other thing. And, and I don't want to kind of give the impression that it's just kind of women that are, working in this, but predominantly it is women that are in this space area of work. But there is just that real passion as women, as professionals, but as members of the public whose families are going to be looked after and cared for. There's that real passion to change and improve things. And I think this particular pathway around loss through maternal separation, as I'm sure it will do as it starts to sort of gather a bit of momentum, people have really become very emotionally invested in this, because, who wants to be a social worker in a court that's there the day that someone's told that their baby's not going home with them? Obviously, women experience horrendous trauma around that, but staff are really traumatized as well. And I think there's a real passion and optimism, because we just think we can do this better. And it might be that it's the same in other areas, I don't know. But certainly in Dorset, there is definitely that passion and that optimism and that coming together to really try and change some of this for the better, really.
I have to say, Jagoda, you have done such a brilliant job today at providing me with segues into my next questions. I swear I haven't paid you in advance. And it is very impressive, because my final question to you was going to be about the future and what does that look like, and is there reason for hope? I mean, it sounds to me like there is, with people like you working on these things, both of you. I mean, Does the future look bright for women and mental health? Are we going to see a sea change?
I think I am always optimistic, and I accept every day that you've got to make choices, you've got to make difficult decisions about the service, how it functions, how it operates, because we are in, unprecedented, challenged times. And the thing is, that's not just about the money and finance. That is just about society. I think post COVID, we are in a very different world, and globally, what's happening as well. And I think that we just have to be mindful that the challenges are massive. I think we really have to kind of appreciate that. But I think that every day when I come to work with my colleagues, I meet women and families that we care for. I get emails from women that we cared for 5-10 years ago, just giving us updates on what's going on. And that is the thing I think that really drives me. And I am optimistic because I think in Dorset, we've been really fortunate that, firstly, I think people want to come and work in this service, and so we've got brilliant clinicians like Jo and her service, and the other professionals that we've got a brilliant perinatal consultant, Dr. Cresta Manning, who is just really passionate and drives that with us. And I think sometimes I feel I really need that. So I am optimistic because I think we've got some brilliant clinicians. I think our organisation, Dorset Healthcare, really supports this piece of work and really supports the service. Dawn Dawson, who's our exec, has always championed this and has been brilliant. At times when I felt it's getting really difficult, I've been able to talk to Dawn and get that support. So I am optimistic. And like I said, fundamentally, it's seeing how women move heaven and earth to do everything that they can to care for their baby, despite adversity, not just mental illness, but other things that are going on as well. So, yeah, I am very optimistic. Yeah.
I mean, it seems like there are also people in the NHS who are willing to move heaven and earth in order to help women move heaven and earth for their babies. I mean, and that's so good to hear. Jo, what would you like to add?
I think I'm also optimistic. I mean, the NHS as a system has its challenges, and there's never enough money. There's never been, and then the message at the moment is that there's not enough money, but I don't think there's ever been a time where the message has been there is plenty of money. So I think that is an ongoing challenge, and will always be an ongoing challenge, is that you don't have quite the resources to do what you want to do, or there's always something that you'd like to do that you're not able to quite do. But I am optimistic. I think we haven't got into the discussion around this issue in this podcast, but yeah, everybody will be aware that there is a government review going on into maternity services at the moment. It'd be interesting to see what the outcome of that is. I think we are relatively lucky in Dorset with some excellent maternity colleagues and some excellent maternity services, but there's always learning. There's always things that can be learned and can be developed and can be improved. So it'll be interesting to see what the outcome of that is and what the learning is, or the changes are that we will need to take forward in Dorset. Ultimately, I would like to see referrals to us or to service for birth trauma to go down, because people are having better experiences of birth. At the moment, I suspect that the referrals will go up for now because there's kind of historical unmet need, but I would like to see them go down in future, not because people don't want to come forward, but because they don't need to come forward in the same numbers. But will always be experiences of loss, sadly. And so, we are here for those women. And we also have a big role to play, I think, in working collaboratively with midwives and other maternity colleagues in terms of kind of training and support for them to do the best job that they want to do and they can do. So, yeah, I am optimistic.
Well, that is fantastic to hear, and what a great point to end on. I can't thank you enough, you two, for such a fascinating conversation. It's been such a pleasure to have you both here. I think we could have kept talking for another hour, but you've both got extremely busy jobs to do, so I'm increasingly feeling guilty for keeping you here any longer. So huge thanks to you both. It's been a real treat, and thank you for all the work that you're doing on behalf of women in Dorset.
Oh, thank you for inviting us.
Yeah, thank you, Mary.
Very, very welcome.
my God, wow, what an amazing episode it was. Like, oh, I'm feeling again emotional, Marianne, what to do?
It was certainly a really, really interesting conversation, wasn't it? And I have really mixed feelings about it, Anjali, but how, you say you're emotional, but as a mum of a special needs child yourself and from an ethnic minority background, this must, how do you feel about these conversations? And do you feel, well, last episode we talked about hope. Do you feel that there's hope for, more support for women like you with your mental health?
I'll be honest, if you would have asked this question to me like 16 or 17 years ago, I myself was thinking, what is mental health? Why we are talking about it? Because that time I came from India, and in India, that time there was I don't see this word quite often, mental health. And after my daughter, when I got to know she diagnosed with this, I think I was going through big depression.
Yeah, I mean, not surprisingly, right?
And I was not aware about it. And I think I had no clue. And I just took it in a way, it's just normal.
Which meant you also had no support.
Yes, absolutely. There was no support at all. And frankly speaking, forget about outsider. I had no support internal also. Because it's like your mother, you need to take care of it. We don't care about your mental health, and there was no talk about it. And in fact, myself was not raising concern of that. I have taken it away. So awareness about this, I got to know later on when I start talking to the specialist women and all the other departments. Then I got to know, yes, I am in depression. I'm going through the anxiety level. I'm going through mental health problems, and I need to address that. And I worked on that. And today I'm here to talk that to everyone, especially in the ethnic minority and my community, because they don't talk about it. They still don't talk about it. They hide. They just want them to show their children are brilliant.
Yeah, so it was great, wasn't it, to hear these two talk about what they're doing. I mean, some of the stuff that Joanna was talking about is just so amazing. And that gives me massive reassurance that there are people who are trying to make things better, right, around women and their mental health, around really difficult times in their lives.
As they have said, the more information, the more voice, their voice need to be heard, and the more support develop and delivered to all these people who are looking for this support.
And I think that's what makes these conversations so important, isn't it? Because how often do we get the opportunity to talk to clinical people like this and tell them and then share that with the general public? So that really excites me. I think that Dorset had this opportunity to really share the voices of women with people like Joanna and Jagoda. So it's left me really thinking, you can almost hear my cogs whirring, can't you, in my head? It's left me really thinking about what they've talked about, what still needs to be done.
I think it's a big task. It's an ongoing thing. It's not every generation. I mean, today we are talking about women with children and all, but there are youth, their mental health because of the competitions, because of the, AI technology tension.
Yeah, as Jagoda was saying, exactly.
Yeah, absolutely. So it's ongoing process, and we need to continue doing that.
Yes.
It's not going to end today. It's not going to end tomorrow. It's ongoing.
Yes. So as always, we end our episode with the idea of more work that needs to be done. Anjali, it's a good thing we're not too busy already, isn't it? So on we go. So make sure you listen and subscribe to the podcast in all your usual places. Definitely check out the Women's Health website. We'll make sure we've got the link there in the show notes, along with other resources that our speakers today were talking about. And we look forward to our next episode, which is coming soon, on sex and sexual health. And we have two amazing experts, as always. Can't wait for that chat, Anjali.
That is coming soon. And I would like to add here, please follow Dorset Women and share this link with everyone so more people can listen to this.
How could I miss saying something so important? Thank you, Anjali, and see you next time.